Hi, Dave Butler here. I wanted to talk about stall bars. Stall bars are something that we use a lot in the Schroth method in scoliosis treatment. And I would prefer that the majority of my patients have stall bars at home. That's not always possible because they're expensive and hard to build and things like that. But if you're looking for the best way to treat scoliosis and the best results with scoliosis treatment, I really suggest getting stall bars because they just make exercises way simpler and way easier for kids as well as adults. And there's some cool things that you can do with stall bars you can't do with some of the workarounds that we have in the clinic. So if you are looking for scoliosis treatment and equipment related to scoliosis treatment, this video is for you. I'm going to talk about different types of stall bars and what to look for if you're getting some stall bars. So don't forget to subscribe to the channel. We'll be talking more about equipment and things like that related to scoliosis treatment. And leave comments if you have questions about specific stall bars. So these stall bars right here, I actually made these stall bars myself. And I will admit they look simple, but they were more challenging than I thought they would be. And the reason is we have all of these bars that have to go into the side rails, and they have to all go in at the same time, and lining them up is a bit of a challenge. In the clinic, I wanted these to look nice, and so it was a little more complex where I didn't want holes on the outside of the stall bars. So if you're building these just for home use and you don't really care about how they look necessarily, there are some shortcuts you can make that you can use to making these so they're not as complex, like drilling screws into the outside. So a couple of things that we're looking for with stall bars. Number one is that they're attached really well to the wall. So with these stall bars, we have crossbars that are screwed into the wall. And so we don't want any movement of the stall bars on the wall. So if they're moving, it's not going to be something that you can relax and really get a good hang or a good exercise on. So make sure that there's something that can attach to the wall well. The other thing is making sure that they're strong enough to support your weight. There are smaller dowels that some people will use on stall bars. Depending on what type of wood, they might be strong enough to hold you, but make sure that it's strong enough to hold you. One of the interesting things with these stall bars, this stall bar goes almost all the way to the ceiling, and we use it to hold different things up top. If you are getting this for scoliosis treatment and you have a different type of curve where you're not going high on these bars, most curves we're not using bars above eye level. And keep in mind that if you have a child with scoliosis, they're going to be growing, so their eye level is going to change. But most of the time we're not using bars above eye level. So if you want to simplify these bars, you could not make the bars that are higher than eye level. The other thing is we're going to use some specific bars, but not everyone needs all bars in the stall bar. So you could figure out with your Schroth therapist, and this is what I'd recommend, go through the exercises with Schroth and figure out which bars you need in the clinic, and then maybe you don't need to purchase as much wood or you don't have to install as many bars for your specific curve type. I highly recommend working with a Schroth provider, a certified Schroth provider, so that you can know which bars you need to be using. So don't just guess. I would work with someone specific on that. So a couple of other things. The closeness between the bars is also important. These are about 5.5 inches apart, and that allows for enough room to grab and maneuver between the bars, but it's also close enough that if we want to change the height of someone hanging or doing an exercise, that we can change that in a smaller variable. If we have too big of a space between the bars, then you can't choose as well which bars you're going to be using. So the last thing with these bars is make sure that whatever you're anchoring into, that the bars aren't rotating. We want those bars to be stable so they don't rotate in the socket. So if you put a screw in the end that bar can still rotate around that screw. So if that's happening, just put 2 screws in there so it's not rotating. With these bars, we added a little brad nail on the back side that goes through the bar into the side rail so that there's no rotation of those bars. So that makes it more stable, and the more stable it is, the more comfortable we are with the exercises, and the more comfortable we are with the exercises, the better we can do them. So quality is important. So let me show you a little bit closer on this. We have these bars that go all the way up. That's where we kind of, as you can see here, we have some of our exercise balls up there. Ideally, we want a mirror in between, behind the bars so that we can see that mirror. And these bars are meant to be used with all types, sizes, and shapes of patients. And so that's why we have them so tall. But quality is important so that they're stable and they're strong. So this is homemade stall bars. You can find some stall bars like this on Amazon. I'll put a couple of links to those, and some good quality wood bars. And I want to show you a couple of other options as well. So a couple of other options we have with stall bars. Here's a little more minimalist stall bar that is similar to what we had before. The spacing between the bars is quite a bit bigger. It has about 3 inches more space between the bars than the bars that I made. And these are anchored to the wall with some metal strips that make it convenient to anchor the stall bar to the wall. There's nothing wrong with this stall bar. It works great, and it's still stable against the wall, except that top one's not all the way in. And it works great, but it is a little more simplistic. It doesn't have quite as much, the distance between the bars is a little bit more. And I think that's important to notice. There are other bars, just like these ones. So this is a set of bars that one of my patients purchased, and they are metal bars. So we have the metal here, and we have grip for holding onto the bars. It has anchoring at the top on both sides, and then it sits on the floor and doesn't anchor other than, like you have anchors you could put into the floor if you wanted. So it also has these wood bars that do rotate in there, and you can adjust those and move those. I'm not a huge fan of the rotation here. I don't think we can lock that down. But hanging from these bars that are up higher would be comfortable because there's quite a bit of grip on there. So that is another option. So we've talked about a few different types of stall bars, and most of them are wood, but there are some metal ones out there. There are different types that people are trying to make so that they're more doable in a smaller space. I think the bottom line is find something that works for you financially and something that works and is stable for you to use at home. The benefit to having good equipment at home is that you are more likely to do your exercises at home. So keep that in mind when you are purchasing equipment. Don't always go with the cheapest option, because if you want to continue doing these exercises long term, because if you have scoliosis, you are going to be doing these longer term, get something that's quality for what you can afford and is helpful for you doing your exercises at home. We do have some videos on how to use different items for minimal equipment, like in the doorway, hanging with straps and things like that. That can be effective as well, but there's no substitute for using good stall bars with Schroth Method exercises. So hopefully this was helpful. If you have found some stall bars that are great, feel free to put the link in the descriptions or in the comments, and I will put some links in the description as far as stall bars that I've seen patients use in the past and those that we use here. If you want to build your own, fantastic, and contact me. I do have some plans on how to build those stall bars. It's fairly simple other than putting them all together, And I recommend you get something that works for you, and hopefully this was helpful for you to see the options that are out there. So thanks for watching. Don't forget to subscribe to the channel. We'll do more information on equipment, and we'll see you next time. Thanks.